Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Aline. I'm sitting at Neck of the Woods Brewing Company in Pittman, New Jersey with my good friend, although tonight foe, Dr. Frey. How you doing?
I'm doing great, Brandon. How are you, buddy?
I'm doing pretty good. As we mentioned, folks, it is Tuesday night, and the Mets and Phillies are playing in the NLDS Game 3 right now.
That's right.
In the background of our show tonight, and Dr. Frey is
It
a Mets
will be
fan.
a short one.
We're trying to get in and out to get some updates for you guys out here. As always, our show is brought to you by Virtual Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work, back and laptop wrist. They got a doc for that. Find the right specialist for you at virtua.org/ortho.
We're in the fifth.
Yeah.
Mets are up 2-0.
Yeah.
Series is tied at 1. We want to watch the last 3 innings.
Exactly. We took an off week last week. We just got caught up with life, and that kind of worked out in both of our favors. We both had a lot of things going on. And
I went out to I brought my kids backpacking in West Virginia.
Yeah. That's so awesome.
Dolly Sods, it was called. It's in the Monongahela Wilderness area, and it was spectacular.
Yeah.
Like, if anyone lives near there, doesn't know about it, wants to go out for a hike or do some, it was stunningly beautiful. We got super lucky weather-wise.
Yeah.
The foliage was changing. It was just great.
And I can attest from the few pictures that we shared before we started recording that it was awesome looking.
Amazing.
And pictures never do that kind of stuff justice. You know what I mean? Like,
when you're there, it's a whole nother level. Yeah.
Oh yeah. And like you were saying, you were disconnected completely, no cell service, you're just out there.
Zero.
And that's
crazy. Yeah.
Sometimes that little detachment is really good for the soul.
Oh yeah, for sure.
So tonight we're taking a little deep dive into a little NFL update. I mean, so far, honestly, it's kind of ironic this NFL season. We just keep talking about Kansas City Chiefs and the wide receivers and how they're going down and their injury list.
Right. Yet they keep winning.
Yeah, unbelievably so, right?
Yeah.
Last night they just played the Saints, and it was like, excuse me, who has over 100 yards? Kareem Hunt and Juju Smith-Schuster.
Right.
These people who have not done so well or been all over the league a little bit.
Right.
And Kareem Hunt looks good, man.
I know.
Great. Like, whoa. And that's only because, again, another Chief got hurt, our homeboy.
Yeah.
The hometown hero, if you will, Isaiah Pacheco fractured his fibula,
Yeah.
which we could have done a whole show on that as well.
And we may at some point.
At some point, correct, especially when he's probably eyeing his return, see what that looks like.
Yeah.
But to go back to week 4, the Kansas City Chiefs were playing the LA Chargers, and Patrick Mahomes threw an interception. And while trying to tackle the person with the ball, whoever made the interception, Patrick Mahomes kind of tucked his head, dove down, and tried to make a tackle, but he dove right into Rashee Rice's knee.
Yeah.
And it kind of made this like little hyperextension kind of look, kind of Varus Force looking, hit.
Kind of like bow leg. It hits on the inside, bows it out.
Bows it out a little bit, and then he goes down in obvious pain, and then next thing you know, he's getting carted off, and it's like, oh man, that guy was on a tear for the first 4 weeks, looking like he's
playing well.
Really well.
Yeah.
And now he's out.
Yep.
And so that happened on September 29th, and then on the 3rd of October, so just a few days later, he was placed on the IR. So that automatically means at least 4 weeks in the NFL.
Yeah.
And I think it was the interesting part about this is why, it's always good to have these topics, is that the reporting of it was so murky, is how I described it to someone earlier. It's just like,
clear as mud.
Knee injury, IR, but, fear is ACL torn. Optimistic ACL is not torn.
Yeah.
May need arthroscopic surgery to investigate more of the injury. Waiting for swelling to go down before getting an MRI or reading the MRI differently. So all this weird stuff where most of the time in these cases over these knee injuries, a couple days there's an MRI says this, and then it's kind of flat out.
Right.
And that's why this one kind of sparked their interest of every couple days something extra was coming out, something different, or a little more pieces to the puzzle, if you will.
Sure. Yeah. And it's not always cut and dry.
Right.
It's not always black and white. There is gray. There are sort of levels in between, and I don't think people fully understand that at times. Like you got the MRI, that doesn't it?
Right.
Like there it is, right there. But no, first sometimes you overread with an MRI.
Yeah.
About 30% of the time, it'll tell you that something's there that isn't actually there.
Right.
Right. And sometimes it doesn't give you everything.
Correct.
Like it slices, right? It cuts. Yeah. And sometimes injuries happen between the slices.
Yeah.
Like the random things can happen.
Yeah.
So it's not 100%. It's not cut and dry. And so when we're getting information like that and we feel like it's murky, are they hiding something? Sometimes maybe they are. They're playing the game, but sometimes it's just not clear yet.
Right. The MRI doesn't always tell you the answer.
Right.
And vice versa. It's like, you're
Especially
treating the
partials.
patient, not the image too. Like if
100%.
you can find those incidental findings of like something random, like, oh, this is a meniscus tear, but they have no meniscus-like symptoms, no meniscus issues.
Yeah.
It's like, who knows how old that is,
Yeah.
especially, I don't know exactly how old he is. I didn't write it down, but a young person been playing, football for at least, say, 5-10 years.
Yeah.
I'm sure his knees are banged up.
Yeah.
And I think there's some things in there that, may or may not be symptomatic or even be related to this injury.
Yeah. Right.
So I think it's interesting because then as everything kind of unfolds a little bit more, today he underwent a procedure, and it was reported that he just needs LCL repair.
Yeah.
And, I think that's important, just LCL repair. And we're going to kind of dive into that a little bit of what that word repair means in this regard.
Yeah. And the fact that it was just LCL.
Just LCL.
Yeah.
And, from Ian Rappaport from Sports Illustrated, is like, well-respected name in media and sources for information. He's the one who reported that the meniscus, the ACL, and the MCL were all intact and didn't need any surgical intervention or fixing.
Sure.
So that's a good sign.
It's a great sign,
right?
If that holds true, yeah.
If it holds true, right?
And so and there are gradations, right? Like so sometimes there is a partial tear, right? And so then that becomes really tricky because is like with the partial tear, sometimes once the rubber once the activity level gets back to normal, where the rubber meets the road, right? Sometimes that partial tear is stable enough that it's not a problem, and sometimes that partial tear is not stable enough that functionally they still have instability or buckling or giving way or laxity, and then that's not good enough.
Correct.
And then you have to go and address it at that point.
Right.
But months down the line. So it can be. It's not always black and white. It can be tricky.
Yeah. And that's, a little flashback here. Like the LCL, we have talked about it before.
Yeah.
Of course, Joel Embiid had an LCL sprain back for episode 71. And again, the isolated LCL is a rarity. Like it's not just something that
low number, 20, maybe 25% at best, I would say.
Right.
Yeah.
I think even lower like if you go collateral ligaments, MCL and LCL collectively,
way lower.
25% total of knee injuries, and this is specific to football.
Yeah.
LCL isolated is like 2% of football injuries, which is crazy. It's like this is way out there, and it's funny. I was talking to my boss today about it, and she's very much like, you never just do your LCL, just
almost never.
It's crazy. You just don't ever see it, and I think a lot of it too is with football. You always see the MCL because people are coming from the outside, coming in.
The mechanism.
Not many times you get hit outside out or inside out.
Right.
You know what I mean?
Yeah, it's rare.
I think the one notable. No, I was just gonna say the one notable one. I think that was like very obvious of getting from the inside out was Robert Griffin III back in the day. His leg was in the air and he got hit by someone on the Ravens, and his leg just snapped, and you saw it. I was like, okay, that's a varus force on a knee, which is not that common. And
what's worrisome, what's ominous, is we all know how that turned out.
Right.
Guy was never the same.
Never the same.
And it's not uncommon. But now this is when the ACL is also involved, but it's not uncommon for that to be the outcome. That people are just not the same afterwards. Yeah,
and I think the optimism is that, well, if just the LCL is getting fixed, it's a shorter return to play. And it's not the 9-month, give or take, plus or minus a few months.
Yeah, and that's where repair versus reconstruction becomes a factor, potentially. Yeah.
So if you want to dive into that a little bit of the difference between, like I mentioned before, the repair versus reconstruction. We talk ACL surgeries often, and most of the time it's an ACL reconstruction.
Yeah, well, the repair is working its way back into the scene, but
But, for this, it's just, there was reported that his LCL was repaired and not reconstructed. So what do you think about that, and kind of what's that mean?
So first, what does the LCL do? The LCL is a ligament. It's a rope that's on the outside portion of the knee, and it goes from the end of the thigh bone really to the fibula, to the, not even the top of the shin bone, but right next to the top of the shin bone, the top of the little bone in the lower leg, and it helps. As you can imagine, a rope that goes across there helps prevent that side from opening up. That even in and of itself becomes a little bit controversial, right? Like we say LCL, but oftentimes there's something called the posterior lateral corner.
Oh yeah.
And which is LCL gets lumped into the posterior lateral corner, but really the main structure of the posterior lateral corner, and there are many. There's arcuate ligament, there's a capsule, blah, blah, blah. But the main structures that we were about from an orthopedic standpoint are the LCL, the popliteus and something called the popliteal-fibular ligament. So if we're doing a reconstruction, we try to address really all three of those,
right,
depending on the reconstruction, right? And if you're doing a repair, I think that if you have to address the entire posterior lateral corner, you're doing a repair, not promising.
Right.
Probably not going to turn out well. If it happens to be a very lucky situation where it is, for the most part, just the LCL, the lateral collateral ligament, then you can do something called a repair. So you're actually taking the injured ligament and you're repairing that.
Right.
So sometimes it tears off of the thigh side, the femur side. Sometimes it tears off of where it attaches down at the bottom, at the top of the fibula. Sometimes it tears in the middle. Those ones probably don't do quite as well. But then let's say it tore off of the femur. You can put anchor or off the fibula. I think that's a little more common. You can put anchors into the fibula head, the top of the fibula, and then sew it down to the top of the fibula. And you're using the tissues that's there.
Right.
The argument against that is that you're repairing stretched or damaged tissue. Right. The argument for it is that you're keeping your own tissue, you're jump-starting the healing process, you're not adding additional graft, and which has to be positioned perfectly or sometimes can create other issues.
Right.
A reconstruction is not repairing that tissue, although you usually throw a few stitches in that. But a reconstruction is then using the graft to replace the damaged tissue. Yeah. So when we do an ACL, we're not usually repairing your ACL, although again that's sort of creeping back into the scene. Right. We're usually doing an ACL reconstruction. You're taking another tendon, either your own or from a cadaver, and reconstructing or remaking the ligament, the ACL. And given how quickly this happened, first 3 weeks after the injury, I think that in all likelihood, this is a repair. So once you get more than 3, maybe 4 weeks out, typically, if you're going to do something to address it, the LCL and or the posterior lateral corner, you have to do a reconstruction. At that point, it's too late to try to do a repair. Right. If you get to it early, you might be able to do a repair. Even with that, the data would suggest that repairs typically don't do quite as well as reconstructions overall. Right. But I think that's also when you're accounting for multi-ligament injuries. So if you're doing the ACL at the same time, you're probably doing also LCL reconstruction, probably not a repair. If you're just doing an isolated LCL, then maybe you can get away with a repair and maybe the results will be good. Yeah. And as we talked about, and not to give away, our hand here, but like LCL reconstructions, posterior lateral corner reconstructions, not a promising outlook.
Yeah, no.
So there may be a level of desperation here. Like, hey, listen, buddy, we can wait and see. And if we can reconstruct that in 3 months because it's not working out, you're probably done. Career is probably over.
Yeah.
So let me just go and try to do what I can do right now and hope for the best, kind of a thing.
Yeah, and that's kind of what I was going to ask you next. Is that, you look some things up and it's like, well, you don't really need to fix your LCL. Usually it can scar down and it can fix on its own, or
grade 1 and 2, lower level tears. Yeah.
Right. And it's like, okay, well, that's a little red flag there. It's like, oh, they went in, like you said, they operated on it. So it's like,
it was probably grade 3. It
must be having like a full tear there. Must be grade 3, right? Yeah. But then, go in there and check everything out just to make sure you're not missing anything. Because again, the images aren't everything. The MRI is going to tell you everything. And the best way to get in there is to look, right? You just get in there with the camera and check it out.
So that's inside the joint. That's arthroscopy. Yeah. This ligament is outside of the joint. Right. It's not actually in the joint itself. So I can put a scope inside your knee and take a look around. I can't tell you a single thing. That's a lie. I can tell you a little bit about the LCL. Mm-hmm. If the lateral joint space, the outside portion of the knee, is wide, then I'm pretty certain, if it's very wide, then I'm pretty certain that you may
Schwarber just got walked, nothing crazy.
All right. Then I'm pretty certain you probably have an injury to the LCL. Right. But I don't actually see the LCL. The only way I see the LCL is big incision on the outside of the knee. Yeah.
And I think that, like what you mentioned too, is that the waiting game is not worth it in this regard.
Potentially.
Like we mentioned, this is a young athlete. Yep. Who has a lot of potential, who is on pace to do a lot of good things this year in the NFL. Very unfortunate circumstance to get this injury. You don't want to lose that investment, as a business standpoint.
Right.
Like, you want to fix it the best you can because, I think, at least locally, the most notable posterolateral corner surgery that
Carson
didn't do
Wentz.
Carson Wentz, right? Like, everybody knows how that went.
Yep.
And that guy's backup. Ironically, for the Chiefs, he's a backup right now.
Oh man,
I'm pretty sure. I'm almost certain
he was like, "Get in there and do it."
he might have some inside scoop of what happens there.
Right, right. But he was ACL, LCL, right?
Right. Yeah, it was a little more involvement than just the LCL. But so I had on here, it's interesting that they were really concerned about other things too, the ACL meniscus involvement. But it's reported that everything's looking good in that.
So they scoped during the surgery, you can do what's called an examination under anesthesia, right? Mm-hmm. He's out. He's under anesthesia. He's not firing his muscles. He's not guarding. He's not protecting. Right. You get a pretty accurate exam on the knee at that point, which is helpful. So that's one for looking at stability of the ACL. And then number two, you have the scope inside there. You have a probe. You grab it. You pull on it. You tug in on it. I don't like what I'm hearing.
2 walks in a row.
Oh,
uh-oh.
And so it gives you a little more insight into to the integrity, especially if you have, like I said, this partial tear of the ACL.
Yeah.
So hopefully it was for his sake. Hopefully they put the scope inside his knee. The ACL looked great. There wasn't a lot of movement. They were tugging on it. Both bundles of the ACL were completely intact. It looked very intact. And we said, we feel confident. Maybe a tiny bit of stretching, but the ACL is going to be fine. So you leave everything else alone, make the big incision on the outside of your knee, and let's start repairing that.
Yeah. So, like we mentioned, today we're recording on a Tuesday. It's the 8th of October, and today he underwent surgery and got his LCL repaired.
Right.
So now what? What are we looking at for a return timeline for him?
Great question. Right. So it's actually faster. It's a little faster than if we do the reconstruction.
Yeah.
So that's on the plus side.
Right.
Although I don't think they're going to rush that all too much, given what he's going back to, which would be the NFL.
Right.
So he's done for the season, for all intents and purposes. I don't foresee him coming back this year.
Right.
People try to do some pretty amazing things. I just don't foresee him coming back this year. He was also facing some legal challenges in the very near future.
It's like I don't mean to say this in like it's good timing of any sort, but like if for whatever reason he the league does take some legal action or some things happen with all this legal stuff in the background that's kind of been pushed off and was suspected to not even like be an issue till next year potentially.
Right.
Like if he gets suspended for the first X amount of games next year, I guess that works out for him because he gets extra time to heal and more, you know what I mean? Like
I do.
It's it's a little. I mean, it's October now.
Yeah. If you're looking for a silver lining.
Yeah, a mild silver lining.
Yeah.
Is that he'll have a little extra time to get back and get healthy with it. So,
so
that's good.
With the repair, typically you're in a really honestly with a repair or a reconstruction, you're in a brace usually about 6 weeks after the surgery. Right. Then you get out of the brace, and you're on crutches. You got to protect it. You don't want that stress stretching out the repair or the reconstruction. You want to then you're out of the brace, you're weaned off the crutches, and in terms of like getting back to normal, close to normal, you're probably looking at more like the 3-4 month timeline with the repair versus a reconstruction, which is still a little faster than an ACL. Yeah. But you're looking probably more like a 6-month timeline. Yeah. Maybe a little more, but in that vicinity. And if you add in the ACL, then it's like instead of like a normal 9-month, you're probably looking like a 12-month, 9 to 12 month sort of bounce back. When
and you put 6 months, that takes you to April-ish now, and so that's OTA's time. And,
trying to get back for next year.
Plenty of time to get back, and then 10 months to get to camp.
Right.
And like we said, he's not just going back to playing recreational flag football. He's trying to be an all-star in the NFL.
And that's a really good point, right? Because if you're an athlete trying to get back to, I just see
double play for you guys.
Yep. Yeah.
Wasted two guys on base.
Is Mania still on the mound? No,
yes.
Is it? Yeah, that is.
Yeah, that's it.
I'm trying to look through the reflection of one of the pictures on the wall because the TV's up behind me. But man, I forget the point if you're getting back to the level of like. If you're a high school athlete getting back to high school football, or high school sports, it's not to diminish what you're trying to do, but your margin for error, right? If you're a really good athlete and you lose a little bit of your your ceiling comes down a little bit.
Correct.
You could still compete on a high school level.
Right.
If you're a really good athlete and you're trying to get to college, your ceiling's a little bit lower because you've had this injury. You can't quite get to where you were before you had the injury.
Yeah.
Maybe you can still get by. If you're a professional athlete,
Right.
if your ceiling comes down at all, your margin of error, like, that's it, you're done.
Yeah.
So people will get back, but the higher level that you perform at, if you're a professional athlete, because your margin of error is almost nothing, it's very hard to get back, especially from these injuries, because people will usually lose a little bit.
Yeah, if you lose that half a step, that makes a world of difference too.
Yeah.
And as a receiver, your job is to make the other guy miss, and you get wide open somehow.
Yeah.
And if you
Cut,
can't do
pivot,
that,
twist,
exactly.
jump,
If you can't do that, your job is for the next guy up, the young guy who's doing it really well.
Yeah.
You know, I mean, if you talk about just sometimes young talent just comes in and amazes everybody. Like there's a guy on Alabama right now, 17 years old, the Williams kid.
Right.
Astonishing footwork. That kid's crazy good.
Yeah.
You know, something happens to him and it could change his whole trajectory of everything.
Next guy, yeah.
Next guy up.
I haven't really watched him. I know too much about it. I just read something about him he's the best receiver in college football right now.
Easily.
17.
And that guy, the best running back is a guy from Boise State who's just averaging like 10 yards a carry. I think his nickname's Mr. First Down or something crazy like that. He just, every time he touches the ball, it's
why
like
would you ever pass the ball?
Yeah, why would you?
First down every time.
Unbelievable stuff. So yeah, I think it's just going to be one of those things where we have to kind of watch it and see what happens with it.
Yeah. Time to pick up Xavier Worthy or pick up Juju Smith-Schuster's
out there
stepping up,
stepped up like crazy. Like what in the world happened there? No one saw that one coming.
Right. You know, of course, Kelsey's going to pick up a bunch of the slack.
He was well overdue, and he had a good game last night.
Yeah.
You know, for Monday Night Football, but it's like the Chiefs just somehow find a way.
They find a way.
Literally, next man up. They don't care who's in. Well, Andy Reid will find a way to make the plays work.
It's a very good combination, Andy Reid and Mahomes, man. They're very. It's a potent offense. They're very creative. They're you know, and like Justin Watson, Nicole Hardman, like the other guys that they're like that are like who take a back seat to some of the like. They can actually still be pretty good just even with those guys, right? Like even though they're not the best players out there, like you know. Ben Roethlisberger wasn't the greatest guy in the world. However, he did make a lot of wide receivers very good. And I don't know if he gets enough credit for it. Think about all the guys who left the Steelers and did nothing afterwards.
And like, Juju was one of them, man.
Including Juju, right?
Like, he didn't have, you know, his rookie year, everyone's like, oh, my God, he's the next best thing, all this stuff. Then he just kind of fell off. He went to the Patriots. You know, he did all this. He was with the Chiefs before, and he kind of came back, and now he's like, if anything, if he keeps on what he did last night, he's on a tear.
Yeah, and so Mahomes has that ability, right? Like he's that kind of quarterback. He's just that good. Yeah. That even though these other, you know, I don't want to call them pedestrian because they're in the NFL and they're
stud athletes for sure.
Yeah.
Correct.
But for NFL standards, pedestrian wide receivers look good if they're catching the ball from Mahomes.
And I mean, just even with that, like Kareem Hunt was a free agent a couple weeks ago.
Right.
He got signed. He got played a little bit last week.
Right.
I think he scored a touchdown maybe last week. I could be wrong. But then this week he goes over 100 yards.
Yeah.
Something he and Juju Smith-Schuster haven't done in like 2-3 years. They haven't had a 100-yard game in 2-3 years. It's like, oh, okay.
Yeah.
Andy Reid just turned back the clock a little bit here, and now they're going to be good again.
Yeah, if you're going to be the center of the offense, you're going to do well.
Yeah.
And you know.
And that's, you know, we've already talked about, like I said, we talked about Hollywood Brown. He's out for the year. Now it's a big pickup. Rashee Rice is out for the year. So they're top two guys, easily receiver. And, I mean, they got lucky. They got Worthy, the fastest guy in the NFL, if you will, by his 40 time.
Right.
And the guy's super quick.
I know. Yeah.
You know, I think last night there was one play where Mahomes looked like an outfielder trying to crow hop and just launched his ball as far as he could.
Yeah.
And Worthy, I think, could have got under it, but he got kind of held in pass interference because.
Yeah.
Why let him beat you over the top like that and get embarrassed? Just trip him, I guess.
That's what you got to do. It's your best chance.
You get most of the yardage without the touchdown, so I guess that's kind of a benefit there.
There's been a few guys, I think, in the NFL that you just really can't overthrow them. And one of the other guys did formerly play for Kansas City, right? Like Tyreek Hill.
Tyreek Hill.
You just can't overthrow them. You're just that fast. You know?
So I think we kind of touch on everything we put down for the list here.
Keeping it quick. So we can watch some of this excitement.
Yeah, for sure. So I guess we'll give a quick shout out to one of our sponsors again, Virtual Orthopedics and Spine. They have you covered from runners knee to dog walkers hip. They have a doc for that. Yard work, back, and laptop wrist. Guess what? They have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, 20 PT facilities, 20 PT rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. So I guess that's wrapping up, huh?
We'll wrap it up.
I think we're good.
We have a couple good topics on the horizon.
Yeah, we do. We do have some stuff that we almost talked about tonight.
Yeah.
But
we
all of
keep it short.
One, to keep this short, and two, all these things are not super time sensitive, and there's going to be more to develop with them. And I think when we wait a little bit, our patience is going to pay off. We're going to have a better show because
a little more information.
Absolutely. So before we go ahead and close out our tab, we're just going to give another shout out to Neck of the Woods Brewing Company, serving us up the coldest beers and the best tasting beers in South Jersey.
Packed tonight.
Oh, and it's a packed house now. Things got going once this game started rolling. And then lastly, Timber Reel Productions, helping us get all this audio, video, and everything out to all our fans and supporters. We appreciate you guys. If you're out there, give us a like on social media, on Instagram, and give us a subscribe and a like on YouTube as well. We thank you, and we'll see you next time.